Hello and welcome to Out and About. Today I'm very fortunate to have with me Dr. Jyoti Sood, a GP from Redbridge. She's also the council lead for the CCG. Dr. Jyoti Sood has been doing lots of public health awareness work around the signs and symptoms of cancer, and today she's here to talk about her new campaign. Hello and thank you for being with us here today.
Manju, thank you so much for giving me the opportunity to come and talk to your audience today.
Can you tell us more about Public Health England's Be Clear on Cancer campaign?
Of course, the campaign's launched about in mid-July and it's going to run till October. The main aim or the focus is on promoting two main symptoms, which is breathlessness and cough. We have done work promoting lung cancer symptom with cough and breathlessness with heart. We are now combining the two because actually these two symptoms could indicate either heart or lung conditions. So we are hoping that those signs and symptoms would reach a wider audience and promote actually pick-up rate of lung and heart conditions.
So the way this campaign differs from previous campaigns is that it's combined?
Yes, and we are focusing on people 50 and over, men and women, particularly South Asian community and patients with low socioeconomic conditions or living in low socioeconomic conditions, because these are risks for heart and lung conditions. It also is encouraging friends and relatives who notice these symptoms in their family members to encourage them to go and see the GP.
So these signs and symptoms that you're referring to, what is it that we need to look out for?
So breathlessness, and we always say it's inappropriate breathlessness. Now, you could get breathless running, that's normal, people get breathless, but it's doing activities that you would normally do and you get breathless. That's not normal.
So basically, if it's an activity someone was able to do previously, and now when they try and do it, they become breathless.
Exactly. The other focus is on cough, which is lasting for more than 3 weeks. Now, with cough could be a sign or symptom of lung cancer or lung conditions like bronchitis. We know that bronchitis is linked with smoking, and so is lung cancer. We know smokers, people who chew tobacco, are at a higher risk of these conditions. So we are hoping if patient has got either cough lasting for more than 3 weeks or breathlessness, we'll be able to, and they present to the GP practices or consults with a doctor, we'll be able to pick up heart or lung conditions, including lung cancer, early.
So it's looking at preventing things from becoming more serious.
Yes, it's more about early diagnosis.
Okay.
So anything that's caught early, a stitch in time, I'm sure you've heard of that item. So anything that's caught early just means that it's an early stage, in which case we can cut it out or treat it and sort the patient out, and you will be absolutely fine living a normal life.
So that's why you guys are focusing on the fact that that's why it's so important to go to the doctor as soon as possible.
Yes, and I'd have to emphasize, it may not be anything serious. It could be lung cancer, but it could be, we pick up heart conditions. We pick up certain lung conditions like asthma, like bronchitis, which are actually also really common conditions. But all these conditions need to be picked up in early stages so that a person can live a normal life with early treatment.
And what are you hoping to achieve through this campaign?
So my main aim is I'm hoping the patients get aware of symptoms. Now, we still know a lot of patients are presenting late or never, whether it's a fear of being diagnosed with something nasty or whether it's lack of awareness. So a lot of people would say, I'm breathless because I'm old, I'm breathless because I smoke. Well, yes, all that is true, but actually could indicate something else as well. Because a person can't just get breathless, it has to be related to a condition. You won't just get breathless. Yes, you could be inactive, you could be unhealthy, you couldn't have a stamina, but that itself is suggested that you need to do something to improve your health.
Earlier on you mentioned that there was 3 sort of categories of people who are more prone to these conditions, and you mentioned South Asian and Black groups are more likely.
Yes, so
why is that?
Yeah. So I'm not going to categorize into sort of ethnic groups, although I would say that any person who smokes, lower socioeconomic, because we know that they don't have a healthy lifestyle. We know certainly in terms of family history, say asthma, heart condition with smoking and eating the wrong food. So all all these are risks for developing heart and lung conditions. So we're trying to focus on age 50, because after the age of 50 your risk of having heart and lung condition increases as well. If you're a smoker, your risk increases. If you're from lower socioeconomic background, then your risk increases as well. So it's focusing to those patients to say, well, actually you're at risk, let's find out if you've got a problem, if you've got those certain symptoms and signs.
And where can our viewers and listeners get more information about your campaign?
So quite simply, a lot of material is at GP practices.
Okay.
But if you are on ITs, and most of the people have iPhones now, if you just type in "Be Clear on Cancer," there's a lot of information there, highlighting in different languages as well, where you can get further information on the signs and symptoms.
One thing I would like to know a bit more about is, why is it that the Public Health England is focusing on these three diseases in particular?
Okay, so now if I look at lung conditions like bronchitis, we know there's about 1 million odd patients or people in the country diagnosed, but we know there's still a lot more that need to be diagnosed. We know heart conditions, quite common in certain groups. We know the risk factors, but we are still not actually diagnosing as much as we should. So we're hoping through this campaign actually pick up the rate of diagnosis, and early diagnosis, I must emphasize, because actually if we diagnose them early, as I said before, we can treat them early, the patients, or people rather, can live a normal life.
And I understand you've also been part of the new video that's come out for this campaign. Can you tell us a bit more about that video?
So the video is focused on actually real patients.
Okay.
One's got a lung problem, another one's got a heart problem. And now it's really interesting, the video is actually highlighting how these patients did have the symptoms and they didn't consult, but then did consult and now are living normal lives. So actually it's really encouraging to see patients who were diagnosed early leading a normal life.
And that will of course encourage those that are fearful of going to the
Absolutely.
GP or have got other concerns.
I have to say friends and families, because I've had so many patients that have been coming in late. A lot of them actually present in A&E, and we know if you present in A&E, it's late stages.
Yeah.
And that really is not appropriate or right for the patient. So actually I've got now relatives encouraging their friends, mothers, sisters, whoever, asking them to actually say, well, you've got the cough, I've heard you coughing for the last few weeks, can you go and see the doctor? And that is so encouraging.
So it's been able to see the symptoms in other people.
Yes.
And being able to advise them on what they can do.
Absolutely.
Is there anything else you'd like to tell our listeners and viewers about in terms of this campaign?
Well, I just want to say, don't be scared of the symptom. As I've said, it usually could be a lung and a heart problem. It could be nothing. It could be something more serious. If caught early, you could be treated early and actually enjoy your life after that.
You know, sorry to backtrack a little bit.
No,
you know, we were referring about the three diseases. So we're talking about lung cancer, lung disease and heart disease. Can you name a few conditions that people might be able to, so it makes a little bit more sense to people?
So lung cancer is self-explanatory. So with lung conditions, we're looking at two main. So you've got asthma and chronic bronchitis.
Okay.
Chronic bronchitis is a condition where your lungs are not able to take in enough oxygen, and it's not as, the function of the lung is to exchange the gases, but it's not able to do that. The other condition, heart, would be like heart attacks, even heart failure. Heart failure, which means the heart is not pumping all the blood out. That could be as a result of that, you could have swelling. So the other symptom to watch out for is swelling of the legs as well. Or you can't sleep flat because your lungs are filling up with water. So those are the other things to watch out for.
And all the literature for this campaign, is it available in different languages, in different...
Indeed. So if you go into Be Clear on Cancer website, there's enough information there. There is, as I said, we have sent literature to all the practices, so they should have information there. But even if you can't get on the computers, you can go to your practice and I'm sure they can print you out further information on this.
I know one of the concerns some people have is that when they're trying to book an appointment with their GP, it can often take them a very long time to get an appointment, or it can be that when they do go there with symptoms, they feel like they're not being taken seriously. What would your advice be for someone who's seriously concerned that they have these symptoms where they could possibly be at the early stages of having one of these diseases, so that they get the
right advice at the right time? Absolutely. I mean, certainly that is a bit of a concern, and I know for sure that if any of my GPs, any of my colleagues hear these symptoms from a patient, they're not going to ignore it. Now, I always say to patients, know your practices. Each practice works differently. For example, in my practice, we know that we've trained our frontline staff. The patients mention these worrying symptoms. They can signpost them. So it doesn't have to be the doctor that sees you. It could be a nurse practitioner who's equally skilled to manage and diagnose some of these conditions. It could be the doctor, or you could have a telephone consultation with a GP, because they could take certain history and triage you almost to decide, well, actually, no, you can't wait a week. We'll have to see you today. So know your practice. Speak to your practice and ask whether you can have a little chat or write a letter. I often get little notes from my patients to say, well, I'm getting these symptoms. And if I feel it's something serious, or I can't work out, I pick up the phone and speak to the patient. And I'm pretty certain all my colleagues, all my GPs would do the same.
So it's just about being persistent.
Absolutely.
Yeah. And when did this campaign start?
So mid-July, and it's going to carry on till about mid-October.
Okay. And how do you see this campaign being rolled out? Obviously, you've been doing a lot of interviews and you've got the video that's gone out.
Yes. So the video certainly is showing at quite a few popular channels.
Yeah.
And actually, it's really encouraging that I've got patients coming to my practice and saying, well, we've seen the video.
Yeah.
And some of them, or most of them, I should say, actually remember what I've said as well. So that's quite encouraging. But there is a lot of other media work that's been done. A lot of advertisements have gone out to other channels, and posters have gone out in hospitals and GP practices. And also we are engaging with the patient group, certainly our local area, to see how they can promote, the patients themselves can promote the message.
So this, in fact, is a massive national campaign.
Yes. It's a really important campaign, as I said, because of the things that we could potentially pick up, the conditions we could potentially pick up from that.
Is there anything else you'd like to add to
Yes.
to this?
So I'd just like to also say to the viewers that the risk factors like lifestyle changes, diet, exercise, smoking, just be happy, enjoy your life. If you want to, then you need to really make sure that you don't smoke. And if you are smoking, get the right help. Make sure you have the right food and exercise. Those are the three factors, not just for these three conditions, but general health and well-being it would promote.
So it's keeping fit,
which is the hardest thing to do, I must say.
Eating healthy.
Yep. Smoking.
Smoking. Okay. Thank you so much for being here today with us, and thank you so much for telling us about the new Public Health England's Be Clear on Cancer campaign.
Thank you.
So viewers, the two symptoms that you need to be aware of is if you're coughing for more than 3 weeks, or if you're becoming more breathless than normal doing an activity that you were previously able to do. And the lifestyle changes that you need to make are that: number one, stop smoking if you are a smoker. Number two, keep fit. That means going to the gym. I know you're not very fond of that, but that's something you need to do. And number three, eat healthy. Thank you so much for being with us on Out and About, and we hope to see you soon.
You hear the word heart failure, you immediately associate it with heart attack, like you're going to die.
The diagnosis was a complete shock to me and my family.
I was very worried, I was frightened, I was upset because I thought I was healthy.
I had pains in my chest and I was feeling weak. I knew something was wrong and I had a cough that wouldn't go away.
Persistent cough or getting out of breath doing things that you were able to do would require further investigations.
I started getting breathless. I made a lot of excuses. It's okay, I'm a little fat, I'm a little heavy, maybe that's why I'm getting older.
If you spot the symptoms in yourselves or your family members, please contact your GP immediately.
Just because you have a condition doesn't mean your life is come to an end.
I was diagnosed with lung cancer, age 77. I'm now 85 years old, living proof that you can survive cancer.
Well, I'm going to continue looking after myself, and I'm going to continue doing all the things that I wanted to do. I will get to the point when I can play with my children on the floor. It'll take time, but it will come.
Finding conditions early, such as lung disease, including cancer, and heart disease, makes them more treatable. So, if you spot the symptoms in yourselves or your family members, please contact your GP immediately. Don't ignore it.